So first of all, you took off the pericardial membranes, and I'll remind you that when we're talking about the pericardium, there are 3 layers to the pericardium. There's the fibrous pericardium, then there's the pericardial space, right? And then there's the visceral pericardium, right? And the visceral pericardium is continuous with the fibrous pericardium as well. And both those pericardial membranes are serosal membranes, and they would make fluid, serosal fluid in the pericardial cavity, which helps reduce friction when the heart is contracting. So the first thing we're going to notice is that we see the atria, they look like little dog ears, right? And they are part of the atria. And then we're going to open it up. I'm going to cut it just a little bit more. I'm going to survey the inside. Okay, so in class when I was teaching you the heart, I said there are simple rules. You should first find the IV septum. Right? The IV septum is separating the 2 ventricles. Then the second thing I said to do is to compare the lateral ventricular walls. And the left ventricle wall is going to be have a thicker myocardium than the right ventricle wall. So I know this space here is the left ventricle, and this space here is the right ventricle. Once you know which side you're on, then you've narrowed down which valves would be found on each side, correct? So on this side, I'm seeing chordae tendineae. Remember I said if someone's pulling on your heartstrings, this is what they're referring to. The chordae tendineae are anchored into these finger-like projections called papillary muscles. And here are the leaflets for the mitral or bicuspid valve. So another name, a third name for this would be the left atrioventricular valve. Now when the ventricle contracts and it starts pushing blood upward, the blood pressure will close these valves, and the papillary muscles will contract and pull on the chordae tendineae. And this is going to prevent the leaflet from everting into the atria. We don't want that to swing the opposite way, because then blood will be regurgitated from the left ventricle into the left atrium. Now, further up, we're still on the left ventricle, but we're going to go up through here. This is the aorta. All of this is still on the left side. So if this is the aorta, then this is one of the cusps from the aortic semilunar valve. The other half of it, of course, is over here. See those? So again, this is just the other half of the left ventricle. The blood gets pushed out to the aorta, and these little cusp-like structures are part of the aortic semilunar valve. The other piece of it is over here. Now the openings to the coronary vessels are behind those leaflets, and you can't really see them in this example. Well, there's a little one right there. But remember I said when the heart is at rest, that's the only time when the blood will pool in these semilunar valves, and then the blood can actually travel through the left and right coronary artery. So it's only when the heart is resting that it will be perfused, and that's very important. All right, well, let's do the right ventricle now. With the right ventricle, we know that it's receiving oxygen-poor blood from the systemic circulation. The blood is going to go into the right atrium, and then most of ventricular filling is passive, of course. Here we see a valve with chordae tendineae, so this must be the right atrioventricular valve, also known as the tricuspid. And again, we see papillary muscles that help anchor those chordae tendineae into the ventricular wall. And down here, on both sides, but I'm going to show you the left side, see where that myocardium looks kind of corrugated like cardboard down here. Do you remember what that's called? It's called trabeculae carneae. Trabeculae carneae. Going back to the right side, let's see if we can find our pulmonary semilunar valve. looks like it's going to be on this side. The pulmonary semilunar valve, I'm going to have to cut. You see my finger is going up here. My finger is going to the pulmonary trunk. Remember, it's more anterior than the aorta. So this is the anterior side of the heart. So what I'm going to do is I'm going to make another incision going this way because the pulmonary semilunar valve is clear back here. Okay? We were looking for that one.
But I want to show her the string part. Yeah, friendly, this is pretty moist. Oh, yeah. I could say, like, wet.
Sorry. All right, so now I'm up here at the pulmonary trunk, going to the pulmonary circuit, and again you can see these cusp-like leaflets, right? So that's one cusp of the pulmonary semilunar valve, right there. All right, so let's do it again. We have the anterior side of the heart. We know that blood is returning to the right atrium. This is the auricle of the right atrium. And then when the heart is at rest, most of that blood coming to the right atrium will go straight down to the right ventricle for 80% passive filling. Up here, excuse me, this is the right atrium still. We're above, we're superior to the tricuspid valve. So this corrugated looking, again, cardboard looking material that you see of the myocardium is pectinate muscle. So up here we call it pectinate, but down here we call it trabeculae carnii. So blood is going to come into the right atrium, passively flow down to the right ventricle. The P wave appears on the EKG. The atria would contract and push another 20% of blood down into the right ventricle. Then the ventricles would start to contract. Blood would be pushed up superiorly and close this tricuspid valve. The papillary muscles will provide a counter pressure on the chordae tendineae so that the valve will not evert. And then the blood is going to be ejected into the pulmonary trunk, which begins the pulmonary circuit, and here we see the pulmonary semilunar valve. Then blood is going to return to the left atrium. Left atrium is back here. It's actually up here. Here's the auricle. And when the left atrium is relaxed and the ventricle is relaxed, then blood is going to come straight down to the left ventricle. Again, 80% filling. Then the ventricles will contract. The blood will be pushed superiorly and close the mitral valve. The papillary muscles again contract and provide counter pressure on the chordae tendineae. The blood is going to be ejected out through the aorta, and here we see one of the leaflets for the aortic semilunar valve. You do not need to worry about the blood vessels coming off the heart or going to the heart because it's very difficult for you to see them with all this pericardial fat. But they will be tagged on the heart models. So you're going to want to spend some time figuring out which vessels are which. Okay.